Hi, I'm Dr. Jay Hall. I'm an audiologist with over 40 years of clinical and research experience. Some of that experience includes newborn hearing screening of preschool children, and hearing screening of school-age children. Hearing loss in preschool and school-age children has long-term negative impact on communication, academic performance, reading skills, and psychosocial status. Systematic hearing screening of young children is an important public health strategy for identification of hearing loss and essential for its prompt diagnosis and effective management. Hearing loss is not uncommon in young children. Universal newborn hearing screening plays an important role in an early identification of hearing loss. However, hearing screening of preschool and school-age children is essential because the prevalence of hearing loss at school entry is approximately 10 times higher than the prevalence of hearing loss at birth. Traditionally, hearing screening of preschool and school children relied mostly on the pure tone or raise your hand when you hear the beep technique. Clinical experiences and research studies have repeatedly confirmed at least 6 limitations of pure tone hearing screening. First, pure tone screening is not a feasible test option for preschool children. Second, pure tone hearing screening is not always possible, even for school children under 7 years of age. And third, pure tone screening with typical earphones requires a quiet test environment. Fourth, the pure tone technique requires 4 to 10 minutes of test time for student instruction and then the actual hearing screening. Fifth, some children with middle ear dysfunction and/or a high-frequency hearing loss yield a pass outcome with pure tone hearing screening. And finally, because of concerns about the validity of pure tone hearing screening technique, pediatricians and primary care physicians often do not refer for diagnostic assessment the children who fail a hearing screening test. The results of recent published research on childhood hearing screening supports a new approach for identifying hearing loss in preschool and school-age children. Hearing screening with a combination of distortion product otoacoustic emissions, DPOAEs, plus tympanometry is most sensitive, efficient, and effective for identifying hearing loss in children under the age of 7 years, including preschool children. Pure tone hearing screening with a protocol that includes signals at 1,000 Hz, 2,000 Hz, 4,000 Hz, and 6,000 Hz is recommended for children aged 7 years and older. This hearing screening video series consists of separate videos that provide a review of 3 procedures that can be applied in hearing screening. Number 1, the pure tone technique. Number 2, screening with DPOAEs. And number 3, tympanometry plus the acoustic reflex. Each video includes practical tips, student instructions, a step-by-step review of the technique, and a closing comment. The videos are supplemented with a description of 2 age-appropriate hearing screening protocols, one for children under age 7 years and another for children aged 7 years and older. Key references are also provided. Be sure to watch all of the videos. Save them as favorites. You can refer to them at any time for a refresher on this screening protocol.